Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we will be discussing smile makeovers and how they can help you achieve the beautiful white smile that many of us so desire with one of the Washington, D.C. area's leading cosmetic dentists, Dr. Michael Chung. Dr. Chung has created smile makeovers for many models and celebrities, is a member of the American Academy of Cosmetic Dentistry, is a graduate of Johns Hopkins University, has received his doctorate of dental surgery from the University of Maryland, and has also received his extensive advanced dental training from the world-renowned Las Vegas Institute for Advanced Dental Studies. Welcome back to A New Me. We are here with one of this area's top cosmetic dentists, Dr. Michael Chung. Welcome, Dr. Chung.
Thank you. Pleasure to be here.
Oh, it's our pleasure to have you with us today. Let me begin by asking you, what exactly does a smile makeover entail?
Well, smile makeover basically is restoring of any chipped, broken, discolored teeth, may have gaps between teeth. All these things can be restored now using the latest techniques. And it can involve porcelain veneers to crowns to white fillings, and sometimes it may just be enhancing with a smile whitening.
And why is it so popular? The obvious is obviously that we want to all achieve that near perfect, if not perfect, white, bright smile. But why is it so popular in your opinion?
Well, I think it's very popular because not only do you look beautiful, but it takes you to another level. It will also give you more confidence, you look younger, you get more energetic. And the patients have reported to me that they feel so confident that confidence carries over to their personal life as well as their professional life, and they become better people, they achieve higher, and they don't just look beautiful on the outside, but they're just more beautiful on the inside as well.
That's right. It's the old adage. We've said it before, but it always applies. When you look good, you generally feel good.
That's right.
Now, if you can please describe the process to us for a prospective patient, what one would be looking forward to.
Sure. In my office, each one of our patients get a customized interview. They first come and get a tour of our practice and meet our team and make sure they're comfortable with everyone. And we sit down and actually spend a lot of time just getting to know each other. Because one of the most important things about this type of makeover is to be able to give you what you want, not what I want to give you. And the last thing we want is a generic smile for everyone. Every individual person has their own idea of how they should look. And some patients bring in pictures, and I want to be able to make sure that we can create that for them and make sure they were a right match.
And how long would this take?
Most of our patients on the first visit, we spend about an hour just getting to know each other, because I think that is very important. Nothing cursory is done in that respect. And then once we, like I said, get to know each other and know exactly what the patient wants, and when I know that I can deliver it for them, then we move on to the continue on with the treatment.
So basically you do a needs analysis, find out exactly what he or she, the prospective patient, is looking for. You customize a solution that can best enhance their smile and give them that smile makeover that they're looking for.
That's correct.
And it's
That's
not
right.
off the shelf, it's
That's
customized
right.
to each particular
Yes.
patient.
Yes.
Okay. And is there any discomfort involved?
No, actually, with all the latest technology these days and advancement in techniques, such as lasers, sometimes we can even eliminate even local anesthetic. And for those dental phobic patients, there's always some. And those patients, we can even do sedation. And basically, they will fall asleep in the chair, and they wake up, and it's done. And for the general patient public, they will just have local anesthetic. They lay down. They watch a movie on a movie goggle, virtual reality glasses, and by the time the movie's done, their procedure is done.
So you're talking about getting a smile makeover and catching a movie at the same time.
That's right.
How dental offices have changed over the years.
That's right.
Now, I believe, Dr. Chung, you have some before and after pictures to show us.
Sure.
Can you please describe them?
Yes, Rocco. Here in this first picture on the left, this is pretty much a case of pretty extreme case where we have lots of gaps, obviously a bad bite, some metal amalgam fillings that needs to be restored. And over here on the right is the after picture. And as you can see, the patient was able to get the smile that they wanted. Here's another picture here, the first picture on the left, showing some rotated teeth and some discoloration, and main thing was that the patient was not happy with their smile. There's another view from the side. You can see how much the tooth has rotated and is tipped way outwards. And here's the after picture. We gave the patient the length that they wanted, the color that they desired, and at the same time put all the teeth perfectly in line as if they had braces done. This is all done in a matter of 2 weeks, in 2 visits. Here's a case of extreme crowding. As you can see, the teeth are not just rotated, but there's not enough room for these teeth to stay in the arch form. And here is the after picture. As you can see, now the patient looks like they had braces done, have the shape of the teeth that they want and the smile that they desired. Here's a case of an extreme staining. This person was born with tetracycline staining, and the antibiotic caused the stains that are intrinsic and cannot be corrected just by doing a whitening procedure. And in this case, we did a set of porcelain veneers for the upper and lower, and the patient was able to get a very beautiful white smile. Here's a case of a patient who came in who had 2 porcelain restorations done, did not like the color or the shape, and as you can see a dark color around the gum lines, and the gum tissue does not look very healthy there, and there's a lot of wear on the teeth. So we rejuvenated all of that by placing porcelain veneers, and as you can see, it frames our lower lip just perfectly, and you have a beautiful smile. Here's a case where the patient had some bite issues, some crowding there, and some misshapen teeth. And the patient also had some discomfort because our bite was not in the right place. So we did the bite correction as well as the smile makeover, and lengthened their teeth, which is what she wanted, and a whiter smile. Here's another case of a full mouth case where the patient had multiple failing restorations, discolorations, and chips, and mainly she just was not happy with the smile. And basically, as you can see there, we rejuvenated all of her teeth with porcelain veneers and crowns, and this is just a full face shot of before and an ecstatic patient after.
You can certainly see the differences in those pictures, Dr. Chung.
Oh, absolutely.
Some very extreme results, and I found it very interesting because obviously there were some cases there in those pictures where there were broken teeth, misaligned teeth, crowding within the mouth, and obviously the Smile Makeover can correct all of the above.
Yes. Like I said, with all the advancements in bonding and procedures and materials, we can do wonders today.
Now, in the few moments that we have left, who's a good candidate for the Smile Makeover?
Oh, you know, just about anybody who's not happy with their smile or who is very self-conscious about their smile would be a great candidate for this type of dentistry. If they find themselves hiding their smile with their hands or just not feel confident about themselves, they're a great candidate for this type of procedure.
Well, that was very informative. Dr. Chung, I want to thank you for being a guest today on A New Me.
Thank you. It was a pleasure being here.
Our pleasure having you with us.